Hi everyone. Thank you for joining. You should be able to see me now. We're probably just going to wait 1 or 2 minutes just in case to get everyone on. We've got quite a few signed up, so we'll just make sure we get everyone on that we can. And then we'll probably start at 2 minutes past 5. And I promise we won't keep you for too long after you've worked all day. But yeah, thank you for joining. We'll start in a couple of minutes. Helen or Lindsay, could you give me a thumbs up if you can see my slides? Perfect, thank you. Right, so it's just hit 2 minutes past, so I think we'll get going so I don't keep anyone too long. So yes, like I said, thank you for joining everyone. Really appreciate everyone's time on the call. And appreciate also that we didn't give you loads of notice, so really appreciate for everyone making the time tonight. So my name's Evie. I'm a senior officer in the health protection team at Birmingham City Council. I'm joined by my colleague Helen. She's a service lead for health protection, and she'll be manning the chat and the Q&A. And Lindsay Trivett, head of service for early years at Birmingham City Council. And I believe we've got some of Lindsay's colleagues on as well. So if you have any questions that are early years specific, they'll be answered by our early years colleagues. And if they're kind of health protection specific, they'll be answered by Helen. So just letting you know, this meeting is being recorded, and we'll share this with you following the session. And your cameras and mics are automatically off. So if you have a question, please pop it in the chat or the Q&A, and we'll get back to you. And if we don't have the answers right now, we'll get back to you afterwards. Perfect. So you might have already seen some parts of the agenda, but we're going to be covering the importance of winter preparedness, some general health protection guidance, how best to prevent winter illnesses in children and staff, including infection prevention and control measures, and immunisations, including flu, COVID and MMR. A bit about the Birmingham context, specifically around measles and MMR, and then managing outbreaks and incidents if they do happen in your setting, how to share the information with the UK Health Security Agency, and when to seek that further support. So the importance of winter preparedness. The winter term is often considered the most challenging. So it's got the longest half terms. Children are adjusting to being away from home or coming back to nursery or early years provision after the summer holidays. Days are getting shorter and colder, albeit you wouldn't think so, being in November and being rather warm. And on top of that, settings might have to contend with winter illnesses. So winter illnesses are the kind of illnesses that we normally see happening and kind of becoming more common over winter. So things like coughs, colds, respiratory illnesses, and some kind of gastro illnesses as well. And winter illnesses can have a big impact on child attendance, and therefore their development and their performance. So ensuring that your setting is prepared to face these illnesses through prevention, infection prevention, and kind of those control measures protects child and staff wellbeing, and then overall setting performance too. So some general health protection guidance for early years. So prompt exclusion of people who are unwell with an infectious disease is essential to preventing that spread. But those with really mild respiratory symptoms, so kind of runny nose, sore throat, really kind of surface level symptoms, but are otherwise feeling well in themselves, can continue to attend the setting. I think everyone's aware, working in early years, if you excluded every child with a runny nose, there'd be no one at the setting. So it's just those children who are kind of really experiencing those severe symptoms, who are feeling under the weather as well. So we've included some links that you should be able to click on, or we'll share these slides afterwards. So one of these is for a UK Health Security Agency blog post, so otherwise known as UKHSA or UKSA. And that provides really helpful information on some of the symptoms of common winter illnesses to help you identify the actions that your setting should take depending on what is being presented at your setting. Some groups of people are at higher risk from infection, including those who are immunosuppressed, so they've got a weakened immune system, and pregnant women. So it might be a useful idea, if you don't already, to have a list of those children and those staff members who are at higher risk, kind of clinically vulnerable, to make sure that they can be excluded or protected instantly if there is an outbreak. And there's also some really handy links to the UKSA exclusion table. So that includes exclusion periods for specific infections, whether or not children need to be at school or away from school. And then also a guide for managing cases of infectious diseases and the actions your setting might need to take. So preventing and controlling these infections, so this is taken from that guide I was just speaking about. This can kind of interrupt that chain of transmission. So if there is someone at the setting kind of presenting these symptoms. So hand hygiene is a really big one. So washing hands before they eat, after they use the toilet, after they've been playing outside, and then respiratory and cough hygiene. So if they sneeze or cough, coughing into a tissue and then disposing of the tissue and then washing hands. Cleaning, especially those kind of high risk areas around toilets and around eating, door handles, things like that. Toileting and sanitation, wearing PPE when necessary, safe management of the environment, which includes kind of linen, soft furnishings, safe management of blood, bodily fluids and waste, and then managing that exposure to an infection, particularly in those high risk groups. So as well as preventing infection through kind of like cleaning and hand hygiene, preventing infection through immunisation is really important as well. So a bit around that in Birmingham particularly is measles and MMR. So you might be aware of kind of the measles situation in Birmingham at the moment, and in the last kind of 2 to 3 years. We've seen more of it than we'd like to see. So if you're not aware already, measles is a really highly infectious disease and it can be really serious. There have been 2 national measles outbreaks in the last 2 years, and in both instances, children under 4 have been the most affected. So Birmingham has low MMR immunisation rates that we're going to go on to on the next slide, compared to England and the West Midlands and where we'd like to be. So we've seen quite high numbers of cases during these outbreaks. So in 2023, we experienced 118 cases of measles. In 2024, we experienced 364 cases. And this year so far, so between the 1st of January and the 20th of October, we've experienced 35 cases. And while that doesn't sound like a lot compared to 2024, we'd like to see 0. So we had the highest number of cases in all upper tier local authorities in England in 23 and 24, and with the 5th highest in 2025. So we've got a map here that's showing immunisation rates for MMR for the first dose for children who are 2 years old. So you can kind of see from that colour coding, the red areas are where we are much below the UK average. And that is the majority of Birmingham. So almost all wards in Birmingham are below the national average for MMR uptake. And then some actual figures. So this is slightly different. So it's 2 doses of MMR at 5 years old. So in Birmingham, we have 74.8% uptake of both doses by 5 years old. The West Midlands average is 83.1 and the England average is 83.9. And the WHO recommendation is 95% uptake to avoid any outbreaks. So while we are quite a way off that, it's also important to understand that the majority of parents have had their children immunised, which is really positive. We've just got a little bit of work to do to get right where we need to be. So the role that earlier settings and provision play in supporting these immunisation programmes is really that bridge between the setting and the parents. So really sharing that information with parents at key points. So when children are due to be immunised and also when they are when they have gone past that point and they're now kind of in that catch-up cohort. So high levels of immunity against vaccine preventable disease can result in herd immunity. So this is kind of what I was referring to a second ago. This occurs when protection from immunisation programmes extend to those who cannot have immunisation. So there will be a certain cohort of people who are not allowed to have immunisations, whether they're allergic, whether they have another illness, they're not allowed to get immunised. And so it's everyone else's duty to make sure we can protect that cohort of people by getting immunised ourselves. And children being up to date with their immunisations is also a huge benefit for parents. We're well aware that parents are very, very busy. They've got very busy lives. And if children have to be excluded from their setting due to becoming ill, it means that their life is kind of even more chaos than it normally is, especially if they've got other children. If then a child is isolating at home, the parent can't go to work, and it's likely that their other children might get poorly as well, which kind of perpetuates that cycle. So getting that message across to parents is really important as well. So let us know if there's any specific information or resources that would be helpful to support immunisation programmes at your setting. That can be kind of leaflets, posters, anything. We've got quite a lot of resources that we can share. So one of these resources actually is this postcard, which is a really handy visual of the childhood immunisation schedule. And as of the 1st of July 2025, so this year, there have been some changes made. So you can see on this postcard where it kind of splits into two routes when a child reaches one. And we'll go over a few of those changes, but it's important that parents know, based on their child's date of birth, whether it is before the 1st of July 2024 or after the 1st of July 2024, what schedule they should be on and what dates they should be being aware of. And there's some links to download that as well on there. So going into a few more immunisations, the flu immunisation is kind of one of the main ones for winter. It's safe and effective, and flu can be really life-threatening for some, particularly those with health conditions, pregnant women and young children. So getting the immunisation is super important to protect yourself and your loved ones and your community, and promoting that at your setting is really important to protect your setting as well. So the best time to get the immunisation is in the autumn or early winter. So now is the perfect time. Ideally, before we get too deep into winter, better to get protected before we reach then. And then eligibility for flu. The highlighted ones in this table are the ones that are most relevant to this cohort, to kind of earlier settings, but there's quite a lot of eligibility for flu. So it's pregnant women, all children aged 2 or 3 on the 31st of August 2025, children with long-term health conditions, so age 6 months to 18, all primary school children eligible and all secondary school children eligible, and all children in clinical risk groups between 6 months to 18. And then there's kind of older adults that are eligible, those living with people who are immunocompromised, and frontline health and social care workers. And children will be offered a flu immunisation injection if the nasal spray isn't suitable for them. So it may be something to, children may have an egg allergy, which means they can't have the nasal spray. Then they will be offered the flu injection, but there will be a provision for them. And then how to get the flu immunisation. There's lots of ways to access this. Speaking to your GP surgery, you can book an appointment online for a pharmacy or at the GP. And for children who are aged 2 and 3, they can just walk into a pharmacy if they walk into the right one. So just making sure that they are aware of who's offering that at the moment. And then most school children will get their immunisation at school through the school age immunisation service. And then COVID. So COVID-19, the offer is slightly smaller, so for a more targeted cohort. This is for adults over 75 years and over, residents in care homes for older adults, and then individuals aged 6 months and over who are immunocompromised. So it's worthwhile making sure if there's anyone at your setting that is immunocompromised or has a weakened immune system, to make sure that they are aware if they're eligible or not. Similarly to flu, you can book that appointment online or through the NHS app, or finding kind of a walk-in immunisation centre or at your GP. But there's lots of links on there again to figure out the best option for your setting. And then the MMR, so we spoke a bit about MMR earlier. We spoke in the context of measles, but the other M and R that it protects against is mumps and rubella. And there's a few changes to this offer as well that are coming into play on the 1st of January 2026, so in a few weeks. So the MMR will be becoming MMRV, and it will protect also against chickenpox. So chickenpox is also known as varicella, so that's where the V comes from. So it'll now protect against measles, mumps, rubella, and chickenpox, which we think will be a really positive change. But it's worthwhile parents are made aware of that before they take their child to their appointment, just so there's no surprises when they arrive. And then also on the ages, so there's 2 doses of the MMR immunisation. Children will all have their first dose at 1 year old, but if they were born before the 1st of July, they will have their second dose at 3 years and 4 months, as is kind of standard currently. If they were born on or after the 1st of July 2024, they will have their second dose at 18 months old. So that's being brought forwards to minimise the risk of them getting measles, mumps, or rubella in between their first and second dose. Anyone unvaccinated who's exposed to someone who has measles may be advised to stay at home for 3 weeks. So that could disrupt their learning or their work or their kind of early years provision. So it's really important to make sure that you're immunised so you don't have to have those disruptions in your life. Children and adults can catch up on any missed immunisations by contacting their GP practice, and people can get immunised at any age for MMR. And then there's some links to some postcards to remind parents and carers to check that their child is up to date, which you can order there. And then moving on to kind of managing the outbreaks and incidents if they do arise in your setting. So as we spoke about before, lots of infectious diseases can be prevented, and they can be managed through infection control measures such as hand hygiene, cough hygiene, and regular cleaning of those high-risk areas such as toilets and eating areas. But sometimes things happen. Sometimes people will get poorly no matter what we do. And then we may have to report those outbreaks to the UK Health Security Agency. So particularly in winter, if there are outbreaks of diarrhea and vomiting or acute respiratory infections, you must report those as soon as the outbreak is recognised. So as soon as more than one person is getting poorly, report that to UKHSA, and we'll go through how to do that in a second. For other illnesses, there's really handy guides on managing those specific illnesses and the exclusion table for how long a child should stay away from the setting, depending on their illness. So if you check the guide and it's either diarrhea and vomiting, an acute respiratory infection, or something else that you specifically need to contact the health protection team for, this is how you contact them. So by phone, you can call 0344 225 3560 and then select option 2. There'll be kind of a lot of options of what to report with, so go for option 2 and speak to someone at the health protection team there, and they'll run kind of a risk assessment, ask you lots of questions, and give advice or guidance on how to proceed, or by email. So there's 2 email options there, and again they'll kind of ask you questions around the situation at the setting. And then we've got some kind of additional considerations for ages 0 to 5, so kind of the cohort that we're dealing with at the moment. So again, I'm sure everyone is aware that children 0 to 5 are bound to get poorly. It's kind of in their nature. They have a really young, kind of immature immune system. They have poor hand hygiene and respiratory hygiene and lots of frequently touched kind of shared surfaces, and they will put anything and everything in their mouth. They'll just there's no stopping them, whether it's clean or not. So they're bound to get poorly. So there are some other considerations to be made around this cohort. So preventing and controlling infections, ensuring all toys are safe, well maintained and regularly cleaned, especially depending on kind of the material that toy is made of. If it's kind of a soft toy, if it's hard plastic, they'll need to be cleaned differently. And around kind of formula milk or breast milk, making sure those are stored safely in kind of a refrigerated area and then disposed of safely if it's not been used. Supporting immunisation services like we spoke about, so encouraging parents and carers to ensure that their child is up to date with those immunisations, and then where possible, allow individuals time off to receive those immunisations. So we're also aware that GP appointments are quite difficult to come by and you get very little choice on whether you attend and what time that attendance is. So allowing individuals that time off if possible. And also encouraging staff to check their immunisation records as well. Like we mentioned, if they're exposed to things like measles and they're unvaccinated, they won't be able to come to work, or they may not be able to come to work for a number of days. And then actions in the event of an outbreak or incident, so reinforcing those basic infection prevention control measures, noting that respiratory infections are common in winter. So like we said, those kind of surface level symptoms, kind of runny nose, they should be allowed to remain in the setting, but if it's anything more severe, then they should be excluded. If the UKHSA health protection team needs to be informed, you should make them aware of the ages of the children in the settings, because this will affect their guidance they provide. And then also additional health protection considerations for children with special educational needs. Quite similar to kind of 0 to 5s that we just discussed. Preventing and controlling infections, making sure all equipment is safe, well maintained and kind of cleaned regularly. Again, making sure that different materials and different textures are treated differently. Supporting immunisation services, again, quite similar to before, making sure parents and carers are aware of the importance of immunisations and how much protection this provides their child, and encouraging staff to check their immunisation records. Actions in the event of an outbreak or incident, so reinforcing those basic IPC measures again, and also getting the individual's clinical team involved if you're concerned about the clinical vulnerability due to an outbreak. And again, if you need to inform UCSA, please make them aware of anyone who's at higher risk of disease. So that's everything from us. We've absolutely whistled through that. And we have some links and resources, so lots and lots of links and resources. So these are all the links that we've referenced earlier in the slides. So for settings, there are some specific ones. For parents, this one might be useful to share out to parents, and some kind of other wider links and resources as well. So all of those vaccinations we spoke about, and more specifically winter preparedness pieces as well. So yes, I think I haven't been keeping an eye on the chat or the Q&A at all, so I apologise. If you have any other questions though, please contact us at the Health Protection Team at BCC. So that's our email there, or contact kind of your early years contacts and colleagues through BCC also. Was there any questions or anything?
So I think there's one in the chat. So how many children need to be affected in an outbreak before we contact UCSA? So in the guidance that Evie shared, there's kind of a list of specific diseases and a specific guidance depending on like what symptoms you're seeing, what disease it is, and how many children should be impacted before you contact UCSA. But there's also some generic guidance. So I'm going to post that in a link in response to your question, Sophie. And then if I haven't answered your question quite, I'll put our email address in the chat and you can get back to us and we can clarify that properly. We also had a comment from Lisa, who said a poster with statistics with the percentages for Birmingham compared with national would be helpful. So that's fine, we can get that over to you as well. And I think there's some stuff going on in the chat. Will we be sent a copy of the slideshow? Yeah, absolutely. This is probably not for this recording, but do we have copies of everyone's email address, Evie, or do we need to put them?
Yes, yeah.
Okay, so no need to put in the chat. We have all your details, so we'll send them out.
What we can do as well is we can circulate the whole slide deck via the early years notice board, so that even people that weren't able to come today will be able to access the slides.
Perfect. I think there might be another question from Tam. Does the nasal spray flu vaccine have gelatin in it? Helen, Can you remind me on that one? Do you know off the top of your head?
So on the NHS pages, they have the best information about what is contained in flu vaccines. So it does contain a small amount of porcine gelatin, the nasal spray does, but there is an option where there is no porcine gelatin in, so everyone can get their flu vaccine, whether they would like that ingredient in or not. So I'm going to, same thing I did with Sophie, copy and paste that detail into your reply. But the ultimate answer is there's a vaccine available for everyone, regardless of whether they would like porcine gelatin or not.
Thank you.
So
I'm just
in the chat, Anzar has said the poster encouraging parents to immunise is good. Can we get a copy or a link? So is there a link in the slide deck?
Is it this one that I shared earlier? I can't remember which ones I've shared now. But yes, we can for that one. That I think those links are available there.
Yes.
Oh yeah, perfect. Yeah, so that link's available. It's really helpful, and you can either download it on kind of on like digitally and then share that out to parents, or I think you can request actual kind of like cardboard copies of them, and they're quite nice as well. I unfortunately ordered about 200 copies of the old version, and then they swiftly changed it, so they will be stored safely. Perfect. I think if there's, and yes, I believe that Lisa, this poster does involve changes. Actually, it's too small to see. If it doesn't, we'll try and provide some posters that do have the information about MMRV on there.
It does.
Oh,
I've
thank you,
just looked at
Lindsay.
it on screen. It does.
Thank you. That's wonderful. Yeah, it's absolutely tiny on my screen. Perfect. Okay. Like Helen's said, please use the email in the chat if you have any other questions. And yeah, if you have any outbreaks, kind of use those guides on the exclusion table on the managing infections guide. And if you have any other questions regarding that, if you're not sure if you need to respond to them, or if you not sure if you need to report it, contact us and contact UXA, and we can help advise on that as well.
Yeah, and if all else fails, remember you do have access to the early years consultants via the early years duty line, so they will know where to go, even if it's not them. So for your last resort, if you can't remember where else you need to go, then go to your early years consultant and we'll take it from there.
Wonderful. Thank you so much, everyone, for joining us. And yeah, we'll get that recording sent round ASAP. Perfect. Fab, thank you. I will stop sharing my screen now and I'll let everyone get off and have a lovely evening.
Great. Thank you very much, everybody.
Thank you.